So 90% as per our yardstick, and you also appreciate, is not sufficient. Those states where some cities have not come on the board, they have not participated, they have not applied, I request, let them, still some time is there, let them review and encourage them to participate. Some, let us say, pass fail, and somewhere if slippage is there, at least we will come to know, and we will provide all support whatever is required. So in this case, apart from that, many states I see, they have very huge potential, and they have worked in huge water management area also, including network treatment. If we see, right from Himachal, Punjab, Haryana, Gujarat, Maharashtra, Karnataka, MP, and many states they have done. They can recheck and guide their ULB to progressively apply more and more in ODF plus and also water plus. So this is very important. And lastly, this CTC, my director will also be mentioning, but here this is, let us say, not only self-checking some of the toilets, and then let us say populating and sending that which toilets are meeting facage parameter, but this is a self-discipline that is coming up. So here it should not see that government of India will come, they will send agency, then we will be ready. This thing, ULB should come up of their own, self-evaluate, and all the time they become ready. So keeping these things in mind, in this webinar we will be covering these things, and we will try to throw some ideas, and then how to score better, and how we can showcase whatever the good work we have done. With this, I thank, and I request now Ms. Pooja to start on ODF protocols. Thank you.
Thank you, sir. So, as Sir said, that this webinar provides us with an opportune moment where we can once again revisit our one of our primary goals is to ensure that we have sanitation systems which are robust and which are able to sustain over time. So, I would be starting with the ODF certifications. So, as you are aware that the CTC campaign is going on right now, and also very soon we will be starting with our ODF certifications. So if you were to go through the CTC campaign and ensure that all facilities are absolutely fine on ground, this will actually help in your ODF certifications as well. So with this, I will start my presentation. Just share my screen. Just give me a second, please. Yeah. I hope my screen is visible.
Visible.
Yeah, thank you, sir. So as you are aware that under the Swachh certification protocols, we have 4 protocols that we have developed over the years. I'll very quickly, because this is very familiar to you, you have been seeing this and doing this over the so many years. So we have the ODF protocol with which we started, which is nothing but ensuring that all your households have toilet facilities. Then we moved up to one more level of ODF plus, where we look at the functionality and usability of your CTPTs at all times. ODF plus plus is another protocol where we look at whatever fecal sludge which is coming out of your toilets is safely contained, is collected, transported, and disposed of. There should be no open discharge. And then we have the Water Plus certification. Water Plus is the highest certification that a city can achieve, and it revolves around ensuring that you meet all parameters under ODF, ODF plus plus plus, and ensure that there is complete treatment and reuse of your used water. The assessment is over the years has been done by various third-party agencies, and there is a robust protocol which we revised last year and has already been shared with all of you. Under the mission, as you are aware, that we aim to ensure that all our cities achieve ODF plus plus, and 50% of our cities with less than 1 lakh population achieve Water Plus. Very simply put, very briefly, these are the main indicators when it comes to ODF plus 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 and Water Plus. What is it that we would check on ground? For toilets, it is about cleanliness of your toilets, availability of water, ensuring that the facilities are available and usable at all times. ODF plus plus, as I said, is safe containment, safe transport, and disposal of your fecal matter. Water Plus is all about recycling of your used water as well. As you can see, this is a snapshot of the certification status of your states and UTs. So we can see that currently all our cities are ODF declared, and we have around 3,913 cities which have been certified as ODF plus. 1,429 are ODF plus plus, and we have 64 cities which are water plus. So this gives you a snapshot of the total number of ULBs and where is it that you stand. So if your cities have, let's say all your cities have moved to ODF plus, then this is a time when you can ensure that all of them move to ODF plus plus. And if your cities have, the cities which have achieved ODF plus plus should now move on to water plus. This is a bird's eye view of where your state stands when it comes to the national average. When it comes to ODF plus, that is your cleanliness of your CTPTs, you can see that we have a national average of 80%. And it's so heartening to see there are so many states which have crossed the national average and have gone beyond. And there are states which are at 80%. But we also need to see that there are states and UTs which have not been able to achieve the national average as well. So we are hoping that this time over, when the application process is going on, we would be seeing more and more cities which will get certified as ODF plus. As you are aware, very recently we had revised our ODF plus protocols, and we have made it into, we have aligned it to the FACES parameters. So FACES parameters is a part of your CTC campaign, and we have aligned all our indicators accordingly. So earlier we have reduced, or you can say modified the parameters into mandatory and desirable, and there are now 10 mandatory parameters and 10 desirable parameters. If you see the mandatory parameters, these are like a basic requirement when it comes to a toilet. The toilet should be clean, it should be functional, there should be water available, a caretaker should be present, a grievance redressal mechanism should be in place. So under the mandatory parameters, it is required that the states, your cities, achieve a minimum qualifying mark of 150. And then when it comes to desirable parameters, we also have 10 indicators here. And these indicators are also very simple. Like, for example, it is like functionality. One of the things that we look at is availability of soap, if there is an O&M mechanism in place, premises are visible to passers-by. So if in the desirable parameters, you just have to score 30 marks. And if you see the parameters, these are very easily achievable. These are easily achievable by your cities. So with the CTC campaign that is going on right now, if you can just ensure that these are met, it'll be very easy for your cities to ensure that their toilets are clean and you move ahead in your certifications. This is the result of the last year's assessment that we did. So you can see that where is it that, there are a lot of cities which were not able to do well. This is an opportune moment. Use the CTC campaign to ensure your toilet facilities are in place, so that when the certification team comes, they will be able to check these facilities and your cities will be able to qualify. This is just a snapshot of what kind of examples you can showcase this with your ULB, saying that these are the kind of things that we would be looking on ground. Your toilet should be clean, your caretaker should be there, your water should be available. These are some of the examples of toilets which are unclean on ground, and we hope that this time over we would not be finding such a situation, because we are going in tandem with our CTC campaign as well. This is a snapshot of what you need to do if you want to ensure that you achieve ODF plus and also sustain it. I'm just repeating what I have said. It is all about cleanliness. It is about usability of your toilets. It is about how functional and how inclusive your toilets are, how properly you are able to, in case there is any issue in place, you are able to redress the same. Moving on to ODF++, as you can see that we stand at a national average of 29% currently. But even then, it is so heartening to see that there are some states which have been able to go beyond 70%, such as the states of Chhattisgarh, Chandigarh, Maharashtra, Gujarat and all. There are cities who are moving slowly towards going up to the national average also. But there are some states, if you can see at the bottom, who have not been able to achieve ODF++ till now. But this time, once again, as I said, we do see a lot of applications coming in for ODF++ this time. So we are hoping that more and more cities advance towards ODF++. This is, in short, the the main parameters which are checked under ODF++, it is all about safe discharge, adequate treatment capacity. Your desludging should be in place. It should be mechanized. Your Safai Mitras conduct all these activities in a safe manner. There is proper registration and licensing of all your operators. There should be a sustainable financing mechanism. There should be a grievance redressal system in place. So looking at our past experience, we wanted more and more our smaller cities to also go towards ODF++. So we have, if you can see, the point number 4 and 8 will not be applicable for cities with less than 30,000 population. So this is, we have kind of rationalized that in our protocol so that more and more cities can advance towards ODF++. One more thing to be added under ODF++ was that for cities which have less than 20,000 population, a lot of them have DRE systems also in place. This is absolutely fine, but you should be able to ensure that these conditions which you can see on screen are met. That is, the site should be away from your habitation, it should be away from your water body, the site of land should be available, and there should be a declaration in place. Only if this is present, then only we can consider your DRE systems as proper and it can be certified. Another thing is that a lot of cities also have cluster treatment approach, which is absolutely fine, but we would want to ensure that all these parameters are also met. That is, you have a proper MOU in system in place, your logbooks are in place, your desludging vehicles receipt is in place, the distance should not be a lot from the parent ULB. Some other things, these things will be checked by the assessor on ground. So we would kindly request that all these documents you are also submitting during this application process, but these documents should also be present with their ULBs. Only if you meet these criteria will you be qualified for ODF++. This is the assessment result of last year. So you can have a snapshot of where is it that you were not able to qualify and then undertake course corrective measures. Some of the examples of what is functional, considered as functional treatment plants, it should be functional, there should be the devices should be working, the logbook should be maintained. Then I will not go into this once again. This is just a snapshot of how you would be able to achieve ODF plus and how you will be able to sustain the same. This is a reference checklist that the assessors, when they go on ground, what all is it that they would be ideally be looking at. Some things related to documentation, like your logbook should be in place, your water quality report should be in place, the resources that you have in the plant, that also should be properly maintained so that the assessment agency can inspect the same. The chain of treatment which is present, all like from the inlet point to the disposal point, everything should be properly checked and maintained. There should be safety protocols in place. The agreements that you have, as I said, with your parent ULBs, all should be available with the ULB. This is the Water Plus matrix. As you can see, Water Plus is the highest certification, and we do see a lot of applications come this year also for Water Plus. So currently we have 64 and we hope that we would be able to double this number this year. So very quickly, if you can see that Water Plus is about safe discharge, once again, treatment capacity, there should be sufficient vehicles, reuse of your treated water is important, the records for the same, where is it that you are using, kindly ensure when you're submitting the application, the documents should be proper and the same should be available with the ULB when the inspection agency comes on ground. Your operation and maintenance costs should be sustainable. There should be a complaint redressal mechanism. As I said before, looking at our past experience for cities, for our smaller cities with less than 30,000 population, we have ensured that that conditions 2, 7 and 8 will not be applicable. So with this sort of rationalization, we would hope that more and more cities, our smaller cities, will be able to achieve Water Plus. This is the application submission. As you all know that we have extended the application submission to 20th of this month, and we would hope that all of you would be able to submit all your applications, because currently all the applications, all the certifications have expired. So if we have 4,900 ULBs, we should be having 4,900 applications from your side. Lot of states have been able to submit 100% of their application is submitted, but there are some states as you can see at the bottom, who have not been able to do so. I'm sure a lot of you still have your applications in the draft mode. Kindly ensure that you submit these applications on time. Please do not wait till the last minute. And for any state which is not able to submit the application for any reason, kindly do reach out to us. There is a dedicated email ID which will just be put in the chat box for you. So kindly send us any query that you have. Send us the name of the ULB, the code and the screenshot of whatever issue is it that you are facing. Especially, I'm mentioning for the last 3 states, that is Mizoram, Nagaland, and Ladakh. I'm sure your applications are in draft, but kindly ensure you submit it on time. And if there is any issue that you face for all states and UTs, kindly reach out to your state coordinators. Please tell them what is the issue that you are facing. So with this, I would conclude with my presentation on ODF certifications. Over to you, sir.
Thank you, Pooja. Before Mr. Manish starts the next presentation, I would like to mention one thing very important. Based on my experience working with city, I assume that in case of these certifications, if concerned municipal commissioner or let us say concerned executive officer, if they spend only few time with the concerned officer who are dealing with them, review only the questionnaire, I think there will be tremendous improvement in their result, because all the points we have tried to rationalize, keeping in view what cities and ULB can achieve. So this sort of request I would like to make, that please see, even ODF plus smaller town we have made very simple, less than 20,000, some 2,500 cities, small cities are there in that group. That is very much achievable. And apart from that, in case of ODF and water plus also, things are rationalized for smaller cities and larger. So please have a look, spare some time, question by question, and then assign task to concerned nodal person, and review only this small sparing of time would bring a significant change. This is my experience, and it holds good for each one of you. Apart from that, as Pooja mentioned, the states which are not able to move forward, I request them, they can connect to us and they can seek further help, any required or whatever the problem is there. In fact, we will also try to now individually reach out to them and find out that what we can do so that they can do quickly. Another thing, because of design of this webinar, this question answer here we will be not taking. So in the side, whatever queries are there, please send there. Apart from that, you can also share it with through state coordinators, and we will have a more proactive system where whatever your queries are there, we will be able to promptly address that. So these things are things we are going to do. Before that, I will request Director Anita Madam if she would like to intervene and tell something. Otherwise, we will then start with Manish. Anita Madam.
Good morning, Charasia ji. Good morning, everyone. I think we should carry on with the further presentations, okay. And then I can.
Okay, Manish ji, please start that.
Unmute yourself.
Just I think there is some lagging from my side. Yeah. Good morning, everyone. Thanks, Charasia sir. Thanks, Pooja. Now we will continue with the next section. The next section is on the JMP parameters, which we have developed in the Swachhtam portal. The various parameters we have defined in the Swachhtam portal, and now the next step is the cities have to report these parameters value in the Swachhtam portal. So the next presentation is about that. What are these various parameters in which various sections we have captured in the Swachhtam portal? So before let me share my screen first. Okay, I hope my screen is visible, right, Pooja? Thank you. Yes, thank you. So Pooja, I think if I invite you to just give a brief introduction about the joint JMP, or so then we would later look into the demonstration part.
Yeah. Thank you, Manish. So now in this session, we are going to talk about the JMP parameters and the ODF parameters that we are planning to, we are currently capturing on the Swachh portal. So to start off with the JMP program, so the JMP program is done jointly by UNICEF and WHO. So wherein what they do is they do a ranking of countries based on their WASH parameters, their sanitation and water and hygiene parameters. They make they see that how many households is it that how many households have safely managed sanitation. So in this regard, Manish, next slide.
Yeah.
So what constitutes as safe sanitation under JMP? So they say that population which is using an improved sanitation facility which is not shared, and the excreta which is coming out of the toilets is safely managed and contained. So in this, next slide, Manish. In this, what we try to see is this is a snapshot of how the various sanitation systems are and how they are laid out on ground, and this is what is meant by safe sanitation. Sir, if you can kindly intervene.
Yeah, okay. Thank you, Pooja. So safely managed sanitation at various forums we have been informing since this GMP has started reviewing this progress. Safely managed sanitation, if we see in very simple term, the excreta of one person should not be exposed to other person so as to create any health issue or environmental issue. Simple चीज ये है कि एक पर्सन का एक्सक्रीटा किसी दूसरे को किसी तरह से एडवर्सली इम्पैक्ट ना करे. वो सिचुएशन तब आएगा जब हम आइदर जो इंडिविजुअल हाउस होल्ड हैं सेप्टिक टैंक के बाद हम सोक पिट रखते हैं तो इट इज कंटेन्ड इन सेप्टिक टैंक एंड देन अगेन इन व्हाट एवर द एफ्लुएंट इज देयर इन सोक पिट और वो द बाय प्रोसेस ऑफ सोक पिट इट इज गेट ट्रीटेड आल्सो once in 3 to 5 years whenever requirement comes the fecal sludge has to be emptied and treated either through co-treatment or let us say at independent fecal sludge treatment plant. So this example I have given for a very simple thing that in case of individual, this comprises what is expected under safely managed sanitation. But individual having this system everywhere sometimes is not feasible, and in many cases when city grows there is a requirement of network and then connection with individual houses and bringing it to some treatment plant and treating there. So if that system is also there, that is also fine. That sewage we are collecting from houses, bringing it to some treatment plant and treating. But where we have to improve for scoring here is that if we have only septic tank and then effluent is going to drain, or directly some places where septic or a toilet effluent is going into the drain, that is not acceptable. So keeping this view, we have requested based on GMP requirements certain data that Pooja will be explaining. Otherwise, go to next one, please. एक और point before she explains, I would like to mention that this scenario you will not appreciate the level of hard work you are doing. That in countries assessment, the rural they have this GMP has assessed 57% because they have twin pits in majority of the cases. But huge work urban local bodies are doing where their score has come only 43%, primarily because after septic tank that is effluent is not properly collected and treated. So in that case, treatment, as I mentioned, it can be soak pit also, or even collected through covered drain and bring and treated somewhere. So this information, once you will feed those things, we will be able to convince them, because we have scored very little in that segment. Sanitation was of course very huge and it has enhanced our ranking, but used water management is one area where we have fared very badly. And it is not only only that we are not doing. If we see population wise, more than 50% our wastewater is being treated. Network is also more than 45-50%. If we take these things will go up, but this will go up only when that whatever good work we are doing, we properly put that data on the Swachh portal. And this is one area what I wanted to highlight. If you have data of sewer network, that also please collect from concerned urban local body, or even in the cases where parastatal or PhD is maintaining, that data should come. It is proportion of population that is required, that how many percentage. This is a simple thing, individual diameter, length, those things we are not asking. Roughly, because they will be able to take what is the percentage that is dependent on sewer network. Then septic tank with soak pit, then septic tank with soak pit connected to open drain and closed drain. These both segments are required, because open drain ke liye perhaps they may not consider, but closed drain ke liye they will consider. Simply twin pit also they are going to consider, single pit they will not be considering. So keeping this view, if let us say ULBs make somebody nodal and they collect from concerned department or those agency we are operating and maintaining, and with help of whosoever is entering data in Swachh portal, these data are correctly fed, then I think it will be a tremendous boost to urban area and our efforts will be showcased. Similarly, in case of used water, total wastewater generated versus wastewater receiving at treatment plant, that is also very simple, that can be easily done, because by measuring whatever is reaching there and what is being treated. Similarly, fecal sludge generated and fecal sludge treatment, these all data is available, only it is a matter of channelizing. And I request from this through this webinar that all concerned municipal commissioner, where these used water things are done in a sizable manner, and all other ULBs also, please definitely have a meeting at it and see that what is system of collecting data, cleansing that data and uploading. And after that, if any problem is there, any challenge is there, our coordinators are there, you can reach out to them, and even we are also there for this matter. You can directly WhatsApp to us, maybe my colleagues, we will be coming to definitely address whatever queries are there, because this is of national importance and all hard work is already done. I request to take it very seriously and personally monitor, so that this sort of data, because JMP team is coming in December itself, and maximum it will be giving time up to 15th of January. So within this bracket, I request that whatever good work we have done, we must showcase there. So this is my requirement. Yes, request. Go to next one.
Yeah, I think, sir, next will be the demonstration only.
Yes. Now
Yeah,
yes, thank you.
Sir. Thank you, sir. Thanks for your input. Thanks, Pooja. So just as an additional point, in the interest of everyone, I just want to say that, if you see that JMP is the unique collaboration between the WHO and the UNICEF, and the basic three parameters they look into: the water, sanitation, and hygiene. Okay, so some of the key facts, if I give you about what kind of data they throw after the evaluation and the report format is like that. In 2022 report for the water parameter, they told that it's still in globally 1.8 billion people do not have the drinking water on their premises. Similar for sanitation, the fact was that 3.5 billion people lack the safely managed sanitation. For the hygiene, they have told that 2 billion people lack basic hygiene service. So after evaluation, these kind of parameters on the water, sanitation, hygiene, they throw in the reports. And if I talk about the JMP overall, what they do, what key facts they do, so if you see, they help to the monitoring of the water, sanitation, and hygiene. Then they help countries for the capacity building, so they can improve their sanitation system. Of course, they work on the implementation methodology after they work on the policy formation, so that you can define the policy, country can define the policies for the better wash, sanitation, hygiene, and water supply. Then finally, they create, as Pooja told, they create a national database. Currently, they have around 5,000 national data available. After that, finally, they execute the reports, whatever the final reports. So these are the brief, this one. Now we will go to the what parameters we have developed and how in Swachh portal you can fill those. So just a moment, I just show you this. First, I will show you one Excel. So these are the various parameters. If you are see this Excel, these are the various parameters we have captured under the JMP. These all parameters are available in the Swachh portal. Now what happens if you see the first parameter, that total household as per the census 2011. This is captured under which module? This is mentioned in this Excel sheet. These are captured in the city details. Now, is there any O&M mechanism present for CTPT urinal? This is under city details. What if there is a O&M, what the document you have to upload? You have to upload in city details. So these are the parameters. I'm not going to in the interest of time for that we will cover in the user manual. So these are parameters we have covered in the city details. Now, if you see, total number of STPs in the city, what are their capacity? These are captured under the city facility, under the processing plants. Now there are households connected to sewer network, household connected to septic tanks, household connected to septic tank with soak pit, without soak pit. These all parameters are covered under the ward details. So these parameters will be under the ward, under the city facility, city profile. Now there are various parameters: how many city, how many PT available to the city, how many urinals available, CTPT is connected to septic tank without soak pit, with soak pit. These all covered under the CTPT module. Then how much daily sewage you are treated, treated, how much water reuse, these all parameter monthly you submit. So these all will come from the monthly progress sheet. Now there are various notifications which we captured in the notification segment, that has you notified the RSA, has the city notified fines against the person who are doing open defecation. So these all covered under the notification. Now there are some parameters which are covered under the Safai Mitra Suraksha module, like total mechanized equipment available, how many desalaging vehicle you have, total PPs, total workers available. These are covered under Safai Mitra. Then there are STPs, any co-treatment is happening, or which kind of treatment is happening, primary, secondary, tertiary. These are covered under STP. So these are the broad parameters we have developed in Swachh portal, and from this Excel sheet you can deposit. These are captured under the various modules in Swachh portal. Now, how the cities can look into. So we have created a detailed user manual, this one. This is also available under the Swachh portal. If you go to the Swachh portal landing page, there you can see, this is my, let me show also. This is our Swachh portal. So if you go to Swachh portal, here we have a user manual section. If you go to user manual, this is the JMP parameter user manual. You click on that, manual will open. So let me show this manual only. So in this manual way, the detail which we have discussed till file is available. Now various screens are available here. So these parameters, this user manual you can refer later also. So just a moment. Yeah. Screen just. Yeah. So the first thing is that you have to click on the Swachh portal with your username, password. This like first parameter is census 2000. In manual, we have clearly specified that you have to go to city profile. You have to upload this parameters, which is available census 2011 household. The next one is IHHR related households who are connected to sewer network, septic tank with soak pit, without soak pit to open drain, without soak pit closing. These all parameters are captured under ward details. So you have to go to city profile, go to ward detail. These all various questions are available here. Similarly, your CTPT, how many CTPT available in Swachh portal? So definitely it will definitely come from your city profile. So for each city, whatever CTPT functional you are having, that will be your count. So if you want to edit it, you can edit from here. If you want to add anyone, you can add the new CTPT. These all you are aware. So now in each CTPT, if you open this form, in this form, you have to provide that this particular CTPT connected how? It is connected to sewer, or it is connected to on-site septic tank, or it is connected to on-site septic tank with soak pit, without soak pit connected to, or without soak pit connected to closed drain. So in that way, these all parameters will be captured here in CTPT module. Now, is there any O&M mechanism present for CTPT urinary in the city? So this is captured in the city profile, city level detail. So in city level details, you have to go to sanitation sector. Under the sanitation section, you will get this question. So this is the question: is there an O&M mechanism present? If O&M mechanism is present, then you have to provide your document. What is your O&M document? So this document user manual is pretty detailed itself. You just need to follow the screenshot and provide your data accordingly. Now, this is how much you are generated sewage, how much you are treated, water reuse. These all, these all captured in the monthly progress report. Whenever you are filling monthly progress, we will extract this data. Now about the your total number of sewage treatment plant, what are their capacity. So in city facility, city profile, you go to city facility, you go to processing plant, then you click on the add new, and then you add your STP. So now against this parameter, what you have to do, you have to go through whatever STPs you have already filled in the Swachh portal, review it. Is the design capacity you have filled properly defined? If you require any update it. If STP plant is not captured, go to and add your STP plant with proper details. So here you go to this form, you click on the STP plant, and that remaining forms you will fill, and then STP will be captured here. So design capacity is also captured here. So then there is a option then in STP, which kind of treatment you are having. So in this form, this question is available here, primary, secondary or tertiary. So whatever you fill, that data will be captured here. Similar is co-treatment being carried out. Co-treatment means in this STP plant, if you click that my actual input is sewage and fecal both, it means it's the co-treatment is happening in this STP. Now, similarly, FSTP, there is another parameter where we are capturing how many FSTPs you are having and how much are their capacity. So similarly, in city facility, you have to go to processing plant, add your plant, select the FSTP, select the design capacity. This is for to addition of FSTPs. If already FSTP is available, it is our submission. You please go through it, review it. All data is with properly, is the design capacity properly defined. If require updation, kindly update it. Similarly, O&M arrangement, if 100% O&M cost of severe network STP are being recovered, you have to go to city profile, city level, and upload, go to this question and update this question. If O&M cost is, if 100% O&M is happening, how much cost you are being recovered? This is the next question. This is again under the city profile, city level details, you have to fill this. Similarly, whether septic desalinating mechanism exists and functional, it is again city level details. This is the question, you have to update it. Is mechanical cleaning used for septic tanks? It is again under city level details, and you have to fill this question 42. Then total now these are some questions which are related to safe mechanized desludging. So here what you have to do, there are sub questions that total mechanized equipment required as per CPHO, that you have to go under city level details, fill it. Now whatever mechanized equipment currently available with you. So for that we have a separate module, Safai Mitra Suraksha details, where you go to Safai Mitra Suraksha details, you provide the various machine documents, the core documents, equipments you are having, as well as the special equipments you are having. So these data will come from here. So benchmark what required, as per benchmarking, what is required will capture in the city level details, but what actually you are having right now, that will come from Safai Mitra Suraksha module. Similarly, so in that way, how many desludging vehicles required, this will also come from vehicle masters. We will take this. But and total PPE kits required, it will come from city level details. Total PPE kits required, but what actually you are having, this will come from Safai Mitra Suraksha, because your equipment details, your core equipment details, specialized equipment details, PPE details, you fill in the Safai Mitra, like jackets, how many helmets, face mask, these all individual details you put it here. So this will come from Safai Mitra Suraksha forms. Now total workers required as per CPHO, that you will fill from city level, but what actually workers you are having, that will come from workforce master. That how many sanitation worker you are having, that count we will take from workforce master. So you have to update your vehicle master, you have to update your workforce master also. Now all private desludging service providers are registered and licensed by ULB authority, yes, no, or not applicable. Then you have to go to city profile, city facility, and fill this question. It's okay. Now some questions are related to notification. So like that plastic ban notification, RSA notification, these all time to time various notifications come that you upload into notification management. So these we will take from your notification management, that respective notification you have uploaded in ULB in your Swachhtam or not. This will come from this module. Similarly, RSA notified, it is also coming from notification module. Is there an ICT based complaint mechanism available for septic tank civil cleaning like 14420 or 14421? This will come from city profile, city level details. You have to fill yes or no in this question. So, and if you select yes, then you have to provide that if it is yes, then is there a proper record is maintaining or not? That is again in under the city profile, city level details. So I think this is pretty self-explanatory, this user manual. So the thing is that only for the JMP parameter, there are various parameters required, which we have captured in the Swachhtam portal under the various modules, so that you do not get confused. We have created this user manual. This user manual is available in the landing page of Swachhtam portal. Please download it, see it, and fill your data properly. Go, and one submission is that please especially go to your CTPT fill the properly details, go to your STP, FSTP plant, see that design capacity is properly and input capacity are properly submitted or not. If any requirement updation is required, please update it. Thank you. So I think this is all a little demonstration. So I think,
Yes.
sir.
Thank you. Thank you, Manish. The important point here is that now format is already developed, information is available. I request that please ensure that within this month, this information is collected and filled, and that will require some sort of, let us say, intervention from senior officers so that within time it is done, so that we can get a good name, at least at an international level. So thank you. We are looking forward, and whatever help is required, any doubt, we are always available here also. Okay, Manish, go to that IHHL process.
Yes, sir. Let me share again. Yeah. So I hope, sir, my screen is visible. Right? Thank you. Visible, right? Thank you. Okay. So, Pooja, do you mind to come here and explain a little bit about the summary part of this?
Yeah, thank you. Thank you, Manish. So before we move on to the IHHL process part, I just wanted to add to the JMP presentation which was made. So kindly note that these indicators that we just showed you will not just be captured for JMP purposes, but it will also be captured for your ODF certifications as well. So it is very important that you fill these details correctly. As you would recall that the number of documents that we used to collect under ODF, we have reduced it to a great extent, and we have made it into indicators onto the portal. So the same indicators are also part of your GMP parameters as well. So it is important that you fill these details, because the same information will be used by the assessment agency to go ahead and verify those details on ground. So time and again, we are repeating it again and again, that whatever details that you fill on the portal, ensure that it is correct, ensure that it is updated. Similarly, for you, as Manish mentioned, your CTPT details, everything has to be updated. Whatever details that you fill on the portal will be used for your inspections. And kindly do this at the earliest, as Sir said, within this month, kindly complete this exercise. So coming to the next part of our webinar is on the IHHL application process. So I would very briefly go into where is it that we stand when it comes to IHHLs. So as you can see on screen, that this is an overall snapshot of how many IHHLs have been constructed since the start of the mission, how many IHHLs as well as how many CTPTs. In the next slide, you would also see, Manish, next slide, please. Yeah, this is the state-wise construction status of IHHLs and CTPTs so far. Next slide, Manish. And also in the next slide, you would see that there are a significant number of IHHLs and CTPTs which are still coming as reported as under construction. So we would request the states to kindly ensure that this is closed at the earliest, because this has been going on for quite some time. So we want to ensure that all these numbers should come down to zero. If there is any issue that any state is facing, or if you feel that these numbers are not updated, kindly let us know so that we can update it in our records as well. Next slide, Manish. This I will not go too much into. This is about the status of how many action plans that we have received so far and what has been approved under SBM 2.0. So under SBM 2.0, there are, as Sir said, there are around 5 lakh IHHL units which have been approved. We would want to ensure that Manish, next slide. We would want to ensure that all these beneficiaries have been identified, and you would be starting with the construction, or probably you would have completed the construction. So these are some of the timelines that we have in place. We would want to ensure that these timelines are met, and in case if it is not, then we would also be withdrawing that amount from you. Sir, you would want to intervene here?
Yes. Yes, here last time when we hold this webinar, we made it very clear that whatever extension for previous and continuing sanctions had been there, that is ending there. And also after completing 10 years, it is not acceptable at your level also, at our level also, that even IHHL continue for 1 year, 1.5 years for construction. So we have decided that in case of CTPT and IHHL, The maximum time for IHHL 4 months, and in case of CTPT 6 to 7 months. So by 31st March, whichever IHHL is not, let us say, put on portal and efforts made to complete, we will try and make that we will withdraw, and again you map those things that this is beneficiary and this is requirement. We will again sanction, doesn't mind. Similarly, in case of CTPT also, if something is got sanctioned and there is no land available, it is lingering on for long period, that will not live as it is as a pending status. In that case also, we will take steps to withdraw, and then you identify land, get ready, again come to NARC, we will be sanctioning. But we want that after 10 years of that effort, the things should be streamlined, and it should not be that there is no, let us say, to take care of those things and things are going without any monitoring and other things. So this is one strong message we want to send, that after 10 years, sanitation, especially IHHL and CTPT, we have to gear up and see that whatever timeline is given, immediately it is completed. Thank you. Please go ahead.
Yeah, okay.
Yeah, Manish, if you can just explain the IHHL portal.
Thank you. Thank you, Pooja. Thanks, sir. So now I will give you a little demonstration about the portal which we are having. So how the whole flow done in this IHHL portal. So just for an introduction purpose, like this is our portal URL, which you must be aware about it. If you see in this portal, we have basically two kind of functionalities available. One for the applicant, who are the beneficiaries of IHHL, and another one is for the official login. So workflow is started in that way that first application register themselves, provide the basic details, name, from which state, from which district it belongs. Then he registered themselves by his mobile number, and then finally he set his password, and then he fill a form. We will see the screens later, but just introduction purpose I am giving you. And they register himself, then he provide a basic details. After that, he said username and password created. After that, he submit with his username and password, and then there is a form will open. That form is for the IHHL. He fill the basic details, which is my Aadhaar number, then Aadhaar authentication done with their name, Aadhaar number. Then he provide the his details, his bank account details, then form he will submit. After once this form submit, then his work, and there is acknowledgement slip generated for that. Then the work of this second official login will start. Then first verifier comes, the verifier will log in, and under the verifier login, that an application lands. He verify this application, go to physically to that particular place, check out that, what is this latitude, longitude, what is the photo, then he upload this photo, verify. Either he approve or reject this application. If he approve, then it will go to the approver. If he reject, then he has to post the reject remarks. If verifier verifies, then it will go to the approver login. Then approver login, he is the final authority to approve this application. Then he approve, see the photograph. If he wants, he can upload further photograph, and in that way that application process completes. Then finally the transaction happen. This will happen in the PFMS system. So this is the basic workflow. So we see this is my portal. If you open this portal, this landing page will open. You have two logins here, applicant login as well as official login. Now the first thing is applicant login. So applicant apply, and he click here portal. If he start on the click here, then he has to provide the name, mobile number, email, address, from which state he belongs to, ID type. Usme you have your driving license, PAN card, some options are available here. Then if you select PAN card, you have to provide your PAN number. If you select driving license, driving number, then enter this CAPTCHA code. You then click on this register button. So whatever, these validations we have explained in this PPT, which we will share later. So you have to click on the register button. Once after filling all this form, he click on this register button. Once he registered this applicant, then after successful registration, application login ID will be generated. So this will be your applicant login ID, and you will get a message as well as the email. The email ID which you have provided. In this email ID and in this mobile number, you will get this number, applicant number. So this is your registration. Now what will happen next? Now here you will go to this screen. After registration, there is a option available here, applicant get one-time password. So you have to generate your first-time password from the system after the registration. Once you click on this applicant get one-time password, this small form will open where you have to provide your login ID, means your applicant ID, which you have generated, then your email ID which you have given while your registration. If these do not match, then the message will come that your registration, your email ID is not matching with your applicant registration, or which you have given while the registration. Then you have to provide code, send one-time password, click on that. The one-time password will be assigned to you. You will get a one-time password. So this is your temporary password. Then you again go to login page. Then this is your login ID. You after login ID and with this password you log in into the system. The first screen will ask you to change your password. What is your current password which you get from your one time? Then you have to set your new password and confirm new password. In that way you will create your new password. So now after this step you will having your login ID as well as your password. Once you log in, then your basic details while registration will open here, what the state, your district, your ULB name, your ward number, which you have provided while your registration. Now next thing is that your form. So you have to provide your name of applicant, father name, registration address, gender, mobile number, what is your status of existing toilet, it is under construction or it is not started yet. Then you have to provide Aadhaar link. Do you have Aadhaar number or not? If yes, you have to provide your Aadhaar number. If no, then you have to provide your application which you have submitted for the Aadhaar. So majorly it will be Aadhaar because in country everyone has Aadhaar now. So you have to provide your Aadhaar number. You have to provide your Aadhaar number. Then there is a validation also happen when you click on the apply that the Aadhaar number is 12-digit number. So is this 12-digit are valid or not? It will not check whether this 12 number is registered in the Aadhaar database or not. The first validation is this one. If it pass, the second validation will check that Aadhaar number and the name of applicant which you have given, these are matching in Aadhaar number. So we have a backend Aadhaar integration. These validations will be checked. Okay. Then what will happen? You have to provide your IFSC code, account number in which your amount will be transferred later on. Then you have to provide your passbook, bank passbook, first copy and photograph or your applicant. Then you will supply on the apply. When this all validations will be done, this apply button will be successful and this application knowledge receipt will be open that by this is your application login on this date. This is the bank account details you have created and I agree to share my Aadhaar details. This acknowledgement receipt you will receive in your email ID, the provided email ID. So your applicant work done from here. He has registered and submitted the application. Now official login will start. The first one will come verifier. So he has to choose this official login, not applicant, official login. In official login, once this they will do the whatever login they have, then they have to go to verify IHHL application. So although they have a dashboard here, they have a little dashboard where everything will come that how many you have received, how many verified, how many rejected, how many approved. These all details will come in your dashboard. But to approve anyone, you have to go on verify IHHL application. All pending applications will be available here. If you click any of the application details and action, this application will come in a detailed way that all details which applicant has provided, name, gender, father, everything, and the passbook copy as well as photograph of the applicant column. Now you have three options: verify, reject and go back. So whatever you will do, suppose that if you verified it, so this status of this application will become verified. So user Vinit Jain is a user, he applied on 8 July and CL Meenaji is the verifier, he verified on this 9th July. So in that way application will be approved from the verifier. If he reject, he will put the reject remarks and the application will reject from there only. But if he approves, verify, then verified status will update and then it will move to the approval login. Similar way, approver will log in from the official login screen and he will go to approve section in the IHHL application. This application will be Vinit Jain application will be available here. In details section, he will go again, this form will open and then he has to provide the approve, reject and go back. So approver can also reject the application. If they approve, that application will be approved. If they reject, then application will be rejected. Okay. So in that way, this approval will be happened. Again, they have a dashboard also. Approval dashboard is also available here where they can see how many they have received, how many they have approved, how many they have rejected. These all details will be available here. So this is the all flow in this portal. And if you see already more than 61 lakh applications have been received and approved in this portal. So majorly work has been done, but still if you want, you go through accordingly. You can ask your beneficiaries to fill the form here, then it will go to verifier will apply, and then this one is in any kind of technical issue, you have to write to support@sbmurban.org if you face anything. Generally the issues which we receive is that one, that my nodal officer has been changed, their name updation, their mobile updation, as well as another kind of issue which we get is basically that my IFSC code is not accepting. So they send us mail from in our system, we verify, and then we upload this IFSC code in our system. Then this issue is resolved. So I think this is all from my side. This a simple workflow: applicant register, applicant submission. After that, officials will verify and approve this application.
Thank you, Manish. Thank you. These things are already from last several years we have been doing. You are all aware, but we don't want to take chance because sometimes some officials keep on changing also. And another important requirement for presenting this was that 5,51,000 IHHL that has been sanctioned. I request that by 15th of January, please reach out to each beneficiary and complete this verification process so that it become one step is complete, and after that incentive can be provided so that we target to complete maximum IHHL by 31st March 2025. So this was our request, and I hope these things will make clear and all efforts will be put so that this is not a big task, it can be done quickly. Thank you. Then thank you, Manish. Then we'll be going to Sirisa. I think she will be presenting. And Anita ma'am, at any point of time, if you have any intervention, you can go ahead.
Good afternoon, everyone. This session deals with, I hope I'm loud and clear.
Yes.
Yeah, thank you. This session deals with the two recent partnerships between MOHUA and two organizations, Sulabh and HUL, for improving public sanitation facilities. As you would recall, some of you would recall, on World Toilet Day this year, MOHUA signed MOUs with Sulabh and HUL to accelerate construction of PTs and CTs and enhance their O&M and through their expertise, cutting-edge technology and design solutions. And recently, on 11th December, MOHUA has communicated the same through a DO about these partnerships and how states can leverage support. Just a little bit of background on the organizations. Sulabh, as you all know, is a renowned Indian non-profit, very synonymous with sanitation. They've been working in the space for the last 50 years. They're best known for the Sulabh Shauchalay, which is a low-cost, eco-friendly public toilet system. Of course, they've also worked on individual house toilets and slum toilets, community toilets, school toilets, and more. They have pan-India presence across 30 states and union territories. HUL, Hindustan Unilever Limited, the model that is we're going to talk about is their Suvidha Center, which was originally established in Mumbai in 2016. This is a community center, it's a convenience center for the community, which offers sanitation facilities, hygiene, drinking water, and also a laundromat, all under the same roof. And the primary audience for this center is folks from lower income urban households who tend to rely on local or community toilets for their everyday access to sanitation facilities. Although it started as a single center in Mumbai, right now they have 18 Suvidha centers that are operational. Now, with this in background, I want to show like two slides on, unless, Pooja, do you have the deck already on you?
Yes, Risha, let me share.
Can you see my screen right now?
No, it's not visible. Now it's visible.
Okay, great. Right. So this basically, the slides basically show you the summary of what we have written in the communication to states as well. So support from Sulabh, according to the MOU, is basically primarily on two areas. The states can avail support from Sulabh to construct, design their public toilets, including O&M agreements. And the priority could be given to high footfall areas like pilgrim heritage sites or railway stations or public transport hub, so and so. So since the Sulabh already has an experience, proven expertise in this area, states can avail support from Sulabh in these particular areas. On HUL support, given their experience of operationalizing 18 centers across the country, states can take the support in construction of a similar model, but the catch would be you'll have to like identify a site, land, and even like a project that can run with a good O&M model, just like a Suvidha. So HUL can also provide design expertise to replicate their Suvidha model in the cities, and they can also provide bill of quantities, SOPs, architectural drawing support, civil construction support, etc., etc. For both of these models, SBMU fund is available, but where applicable, CSR fund can be leveraged, and this will require both support from state and cities as well. For Sulabh, pilgrim areas and heritage cities are more ideal, but not necessarily restricted to them. It's completely based on this, what state thinks is the right decision. And for Suvidha centers, we would recommend that build at least one Suvidha center in a million plus city. So for Sulabh support, the idea is you could identify older public toilets and community toilets that are older than 15-20 years. They're in a dilapidated condition that need upgrading or retrofitting or complete new reconstruction. This could be taken under Sulabh support. And for Suvidha Center, we would recommend that the site be selected in high density areas like slums or high population areas, high rise areas where there are more low income households who can benefit from the facilities provided under Suvidha centers. So in the DO, we've also shared a template requesting states and cities to identify where they might plan to build Suvidha centers, similar centers. And we need to select the site and also identify the site based on these parameters that we're discussing, access to public, access to the right kind of users, and also provide a rationale for the selection of the site so that, the same may be conveyed to HUL and we can take this forward. These are the slides, and in case you had more questions about what kind of support, what is the funding available, etc., etc., you can reach out to the PMU here. And also to support, we have also written on the DO the email IDs from Sulabh and HUL. Can coordinate and email them for more details. That's it from my side.
Thank you, Srisa. So this was basically primarily this MOU we have entered. This is especially HUL. They are already doing somewhere. They are bringing even CSR fund also. They have technical capability, and they are also have, let us say, encouragement to provide help to urban local bodies, especially those who are having, let us say, million plus city, are having those congested area where their model is more suitable. So cities can reach out to them, and through this MOU, they will be able to help wherever additional help required. We are also there. And similarly, in the case of Sulabh, they are already well known. In case of high footfall, they have developed some models, and also for heritage cities. Apart from that, two another important areas, if Sulabh is maintaining many let us say sanitation complexes in prime area in the city, and some of them may be in dilapidated condition, and some may be requiring some let us say retrofitting. Such type of cases also ULBs can take their help, and they will be ready to do that. So in light of this MOU and the facility that is available and expertise that is available, states or cities are requested that they should come forward and take their help so that we can strengthen the sanitation to next level. That is our expectation. Apart from aspirational, this sort of things are very much needed. So thank you very much. Now we will go to this clean toilet campaign. If director at some point of time would like to put some remarks, that is welcome.
नमस्कार चरसिया जी, नमस्कार सभी को। आई थिंक एक बार हम लोग प्रेजेंटेशन देख लेते हैं, व्हाट इज द परफॉर्मेंस सो फार बाय द स्टेट्स, एंड देन आई विल डेफिनेटली इंटरवीन व्हेन एज एंड व्हेन रिक्वायर्ड.
So, Kritika, please go ahead.
Wishing everyone a very good afternoon. And like the context and the importance of the sanitation and the access to the toilets and their functionality has been rightly set by my previous colleagues and seniors. So Mahua SBM Urban has started a campaign on Clean Toilet Campaign in since 19th of November. This campaign was launched. And we're running in the week 4 of the campaign now. So I'll be presenting the results and the analysis of the campaign so far. Is it not moving now? Okay. So the highest leadership, the Prime Minister himself has set the vision for the importance of the community toilets and their maintenance at all given point of time. Keeping this in mind, the campaign was designed, and the campaign this year has 6 parameters. First is the evaluation of the toilets, then the corrective action which needs to be taken up at the ULB level, then ensuring the operation and maintenance of the toilets, and then who is accountable for the maintenance of the toilet. Then for this we are mapping the operation and maintenance models which are existing countrywide. Then how you can engage the public with the campaign is basically through enabling the real-time citizen feedback through the My Toilet app. Then the footfall mapping, which is also another component of the campaign this year. So as we, last year we had introduced FACES parameters, which basically depicts the functionality, accessibility, cleanliness and eco-friendly nature and safety for the community and the public toilets, which are funded under SBM. So we now go to the statewide status. This data has been analyzed as per the data which was retrieved 11th of December. So the analysis on the is based upon that. So Andaman and Sikkim, they are the 2 states whose target has been achieved. We have set the expected nomination to 75%. So as you can see, the green band basically shows the...
Here I would like to intervene. If anyone is present from Chandigarh and Chhattisgarh, the number of toilets nominated in CTC 2024 is 0 so far. So this is not acceptable, and may I know the reasons why is it so? Is it like we are waiting for the last week of the campaign, or we are facing some another kind of problems? If anyone is attending the meeting from Chandigarh and Chhattisgarh, please share your thoughts. Why is it 0? And please do your best to increase the numbers.
Kritika, you can proceed. We will take their view.
Is there anyone from Chhattisgarh? Can we hear from them?
Maybe, ma'am, we can separately reach out to them, these states which are highlighted, and try to see, and whatever help is required, we will provide so that they quickly populate that data. Right? Yes, please, Kritika, go ahead. This is only to note down that Chhattisgarh, they have been performing very well in all formats of certification, and this is simply part of that only, let us say, extended part. So here, Chhattisgarh, if 1 out of 190 it is 0, we are not able to understand, but definitely we will separately speak to you and try to find out what is the reason and how we can further strengthen it. So Kritika, continue.
Hello. So as you can see, the green band depicts the latest. So the green band shows the latest number of the toilet blocks which are there in the Swachh portal, and then the CTC 2023 results. So lot of states there is a slippage. There is a decrease in the participation in the campaign this year. So we'll share this with you. You can refer to this for planning the rest of the 2 weeks which are in the campaign. So similar is the case with Ladakh. The participation hasn't, the nomination has not been started so far. And this is for the rest of the states. So as per the total, if you can see, last year only 16% nomination was there, and within the 4 week of the campaign, we are still lying behind much behind the last year nomination as well. So it is just 7.4%, and as on date, like today, we checked the portal, so it was 10% this morning. So the states and UTs, they're expected to nominate 75% of the toilet. So we've calculated the expectation. So accordingly, the rest of the 2 weeks can be planned by the states and UTs. So analysis of the mega cities was done, which is also fairly low, where out of 5,000 plus toilets, only 74 toilets have been nominated so far. Then the million plus cities. Here also, as you can see, the nomination of the toilets is really low, which is out of 8,000, only 219 toilets have been nominated, and the expectation in terms of the campaign during the campaign period is also mentioned. So another activity which we have, another assignment which we have done is basically mapping of the O&M models which are prevalent countrywide. So so far, out of 70,000, 11,000 toilets have basically been, the reporting for 11,000 toilets has been done. So this is the bifurcation, state-wise bifurcation of the analysis. So overall, if you can see the division, like basically we had mapped, one is the deployment of the full-time, the O&M model is basically being, O&M model is that the deployment of the full-time caretaker is there. Then it is like fully managed by ULB, no user fee is there. And then managed by the individual entrepreneurs or market level committees. There are some other models, or it is through partnerships or advertisements, or there exists a user fee model. So out of 70,000, so far only the reporting has been done for 11,000 toilets only, which is fairly low number to come to a conclusion that what are the prevalent O&M models. So we request that if the same, the reporting of the same can also be expedited. Another thing which we are doing is basically the daily average footfall, so that we come to a conclusion whether the planning of the CTPTs which are there in the cities is being done at an appropriate level. So this is exercise. This is being exercised in view of that. So so far 18 lakh users have been reported by various states. So this is that analysis. So and Chandigarh, Ladakh, Meghalaya, and Nagaland, they are yet to start their reporting on this. So this is today's screenshot from the portal, that 10% nomination, like the previous analysis was done till 11th of December. So this is as on date 10%, which is also fairly low. So it is again a sincere request to take the campaign a little more seriously and expedite the nominations. So this is it from my side. I'll stop here on my presentation.
एक पॉइंट मैं थोड़ा सा हाईलाइट करना चाहूंगा ऑल सिटीज को. इन केस ऑफ ODF certification, around 90% of city have participated. But when it is coming for CTC, here the participation level is around 10%. These all cities are going to, let us say, come under this certification process, and third party will be visiting. So once you have applied, I think CTC is very good opportunity, excellent opportunity, that you yourself through your agency get it monitored and then be ready, so that the pass percentage increases. Because at this time, after 10 years, how many times we will keep on slipping? So I request that commensurate to those 90% what ODF certifications में cities has applied. This CTC also match that, and even generously, I think JS ma'am have set target only for 75%. But we request, if it is possible, please go beyond that and match that very quickly. I think that will be good. Over to Director ma'am.
Thank you, Chaurasia ji. आपने पहले ही बता दिया. सबसे पहले तो the percentage of nomination is very low. Everybody has seen their performance, and this needs to be improved. And number two, what you have already told everyone, that maintaining toilets, first of all, constructing toilets is the primary focus of Swachh Bharat mission. Then it is not only the construction, but to maintain them clean and to sustain ensuring utilization of CTPTs and spreading wider awareness to use them in the best possible manner is also our primary responsibility. And this primary function of CTC challenge is also to improve sanitation services in the cities, and which is very integral for good governance. So it is a very good opportunity for everyone to please take stock of your SBM assets, upkeep, maintenance को आप best कीजिए. Please find out the best models of O&M, and this is also a very good opportunity to felicitate the best caretakers in your cities and ULBs, so that your CTPTs are functional and accessible and clean all the time. It is not just for the last these 5 weeks. We only have 2 weeks left, so the nomination has to be increased. Plus, your upkeep and maintenance has to be improved. And number three, this campaign should give us an opportunity to find the best models that can be replicated in the country for other cities to use. I really would request everyone to please give us some very good models that we can showcase at the highest level, that this is what our country is capable of doing, and this is what our cities are doing at the ground level. So this is all from our side. And wherever the nomination is zero so far, so I will request those cities, especially the mega cities and the million-plus cities, this is something which is a matter of concern. So everyone is looking to the real causes for this, and what is it that we at MOHUA can help you in that. If you need any kind of hand-holding or some problem is there in the reporting modules, please let us know so that we can help you out. This is something which is very important now, because we don't have much time. Another thing which I would like to just reiterate, that Sirisha just told everyone that regarding this MOU and MOU between HUL and SULAB. This is also a very important step towards constructing new and aspirational toilets and using new methodologies of HUL and SULAB. So this is also a very target date is very nearby. It is 31st December only. So please give us the data related to that also in the template that we have shared, so that necessary action can be taken further. This is all from my side. Thank you, everyone.
Thank you.
I just wanted to add that I think if admin can unmute the states, I believe Chandigarh was also trying to respond. Admin, if you can unmute, if anybody wants to say something. Yeah.
I think, Pooja, it is not required now. Chandigarh, Chhattisgarh, and whosoever, I will be taking review in the next week separately with the states. Whosoever is finding, and in any case, we are here. So please feel free to reach out to us so that whatever is there, we can share. Thank you.
Yeah, so now this
Pooja, whether somebody has contacted, otherwise individual, whatever feedbacks and wherever the problems we have identified, we'll reach out to them rather than in entire forum they explain. So maybe they can quickly do, otherwise we will close the meeting because already all presentations have been completed.
So we can take it separately. As ma'am said, she would be conducting reviews with the states separately. So we can take it up during that time. Yeah.
Right. I think that will be better even in case of Chhattisgarh and all other states and cities we have seen. I think through our national PMU resources, we will reach out to them and try to see that how it can be expedited. And if there any genuine problem is there, definitely we will come forward to address that.
See, taking names of Chandigarh and Chhattisgarh is only
So-
because they are one of our best performers. So
Then
we definitely expect much
we have
more from these.
completed all the presentations. Then we can close. I thank all the state governments, cities representatives, and all those resource persons who have participated. I thank Director Swachh Bharat Mission and my entire PMU team who has been very instrumental in organizing and presented all the things in a very clear manner that I think states will have noted, and they will take action, and we will be able to improve upon it. So thank you from our side. Thank you very much. We close the meeting. Thank you.